It gives me great pleasure to welcome Professor Nicola Spurrier to the Rotary Club of Adelaide and to the International Women's Day lunch. International Women's Lunches are celebrations of women everywhere and the monumental impact they've had all over the world. You will have read Nicola's extensive bio in our bulletin, so I won't go into that any further, and you will realise that her accomplishments are in keeping with the philosophy of international women. Today she will speak on the challenge of being the Chief Public Health Officer during a pandemic. And one of those things is having to go past the anti-vaxxers as she came into our meeting today. So I'm pleased you arrived safely with your guard.
Nei nari Nicola Spurrier. Mani naglu timpandi, naglu. Gana yatanga imparendi. Kumatana yatamaranu nai timpandi. I acknowledge we're meeting on Kaurna land and also acknowledge any Aboriginal people who are here today. And what a pleasure it is to be at the Adelaide Oval instead of walking around checking out the COVID safety, making sure that there's hand sanitizer and people were wearing masks, just to be here, to have fellowship and to sit and have a chat with all of you wonderful people and enjoy the hospitality and, of course, the beautiful view here. So I do thank Rotary South Australia for inviting me, and Kay Dowling, you have been very persistent, and I'm sorry I had to stand you up last year. Also, could I acknowledge that I'm also accompanied by my mother, Leslie Smith, today. My mother is a wonderful woman, but she is not just a mother, she is a renowned pathologist. She was the president of the Australian Cytology Association. And so on International Women's Day, I just would like to acknowledge my mum, who has obviously been a great deal of support for me during the pandemic, along with the rest of my family. And of course, it's not just all about women on International Women's Day, it's all about also acknowledging the men who are our feminist allies in this push to make sure that we have equal rights for women and men across not just Australia but internationally as well. So, look, I am going to speak about COVID, but there's lots of other things that I do. I'm just going to put this screen down because it's just in my way a bit. There are lots of other things that I do as Chief Public Health Officer, but COVID it was such an unprecedented time, and it is important that when we have those sorts of things that happen to us as a state, that we take the time to think back and learn some lessons from it and put those things into action, because we've got other public health challenges and we've got to make sure that we've learnt things and don't make the same mistakes again. So I'm going to follow a little bit of a progression through some of the challenges, some of the strengths that we had in South Australia. I'm also going to mention some of the strategies, but I wanted to finish on the lessons learned and what we're doing in my division, but what I'd like to see else happening in South Australia. So let's have a think about some of the challenges. If you turn your mind back to the beginning of 2020, actually one of the things we'd just got through were the bushfires, and they were really bad in South Australia, but not as bad in terms of air quality as some of the bushfires interstate. And I remember thinking, because there was a lot of talk, if you remember at the time I was doing some radio around wearing N95 masks, and people couldn't get them from the hardware store and whatnot, and that was to do with air quality. And I remember thinking, I hope our national medical stockpile have sufficient of those, given that there may be this virus becoming a problem. So that definitely was one of the challenges, is that not everything that you would think that we would have in Australia is made in Australia. And of course, where do you think masks are made? Surgical masks are made in Wuhan. So that was one of the big challenges, first up challenge. I think the other thing about the challenge was that it was hard to believe that we were going to have a pandemic. And the doctors that I'm friends with, we were getting text messages from ICU consultants in other countries, particularly from Lombardy and Italy, saying it is apocalyptic. If you can do something about it. But we were still seeing sort of odd images on the TV about China building a hospital in a week. And do you remember there was a little meme with all these bulldozers? And it was all kind of a bit, humorous, and possibly this wasn't true. So the fact that it was unprecedented, never happened before, it actually meant that we had to use our imagination and actually comprehend that something could happen like this. And my daughter in 2020 suggested I read the book by Albert Camus, La Pestilence, The Plague. And at the beginning of that book, the doctor says he had to have a little bit more imagination, and he'd seen pain and bad things happening, and he was the one that recognised that the rats dying in the street were because of plague. But that sort of sense of being unreal. We, as a Chief Health Officer meeting with AHPPC, Bruce Aylward, who was a professor from Canada and worked with the WHO, gave us a video presentation, and it was, I remember taking type notes and just being flabbergasted about what he was saying. He'd been into China and he'd done this investigation and was explaining what was happening. And it was then we all sat up and listened, and he said, if you can stop it coming in, stop it coming in, which was when we had made that, gave the advice to government to shut the international borders. And we really had to, because our strategy was to, you remember, flatten the curve, but what we needed to do was prepare our health systems, because we could see other health systems being completely overrun. So one of the other challenges is that it's a new virus. So we know about flu. We've had thousands of years of the flu. We know about things like TB. We've got lots of evidence base. There's lots of things when you look on our medical research about all these other things, but we didn't know anything about this virus. So that in itself is a challenge. And I'm looking at Nan Vassiliounas down here, who's a co-paediatrician, and we're used to looking up things as paediatrician on evidence-based, up-to-date various websites. But if you looked up SARS-CoV-2, there wasn't very much about it. So it was, and there was no rule book. The other thing for me personally, which was a challenge, was I'd only had the job since October the year before, so 2019. So I'd inherited a number of teams in the department, and I was just getting to know them. I was thinking that we probably needed to do some work breaking down some of those silos, from a management point of view, but I didn't have an opportunity to do that. So that was a personal challenge to me. The other thing was when I looked at our public health system, and when I say public health system, I don't mean the public hospitals, I mean the systems that protect you from health problems and also prevent you getting sick. And so those are the systems such as keeping wastewater systems functioning, making sure that everybody's got clean drinking water, the communicable disease control and outbreak control and such like. And our public health systems were pretty antiquated. There hadn't been any investment in public health. In fact, we'd had budget cuts over previous years. And we were using pencil and paper, so that was a real challenge when we were doing contact tracing. We were used to only sort of contact tracing about, 3 or 4 people with a meningococcal outbreak, and we'd just do it on the phone, and the doctors and our staff would handwrite notes, and if we were lucky, that might get into a computer. But we were not going to be able to deal with contact tracing on the scale that we knew we would need to. So those were some of our challenges. But South Australia is a fantastic place to work, I have found, because I call it the Goldilocks city. It is not to South Australia, Goldilocks state. It's not too big and it's not too small. It is just right. So we're big enough to have to be able to scale up, but we're small enough, and it means we know everyone. So even coming here today, I just bumped into the wonderful Jeff Tate, who told me his bridesmaid was the mother of my best friend at school. And so we have those connections in South Australia. And when you're doing public health and working to improve the health of the whole population, you need all the partnerships, because an individual doctor can't improve the health of the whole population without partnerships across other sectors. The other strength that we had here was obviously we had that early warning because we're an island continent, we were further away from Europe and from the US and UK, so we had that time to put the borders in place, so that was obviously a strength. And that meant we had time to do some preparations, and I just wanted to acknowledge our Chief Procurement Officer, Andrea Andrews. She was the person that negotiated with China to have initially 13 mask-making machines come to South Australia, and it was set up with Detmold and the universities, and we made our own masks, which was, as Nan's nodding here, really it was just so important because we knew we wouldn't be able to cope with this virus without it. The other strength that we have in South Australia is that we have really, we've got legislation that when we have an emergency called, it's the police commissioner is the state coordinator. So it's actually Grant Stevens that made every decision. And I was in charge of what's called the control agency, so he needed to get advice from the control agency, so he took public health advice. Then he would take advice from elsewhere, and then he would make that decision. And I just really wanted to recognise publicly Commissioner Stevens because he is a leader with such a degree of strength, but in a very, a relaxed manner and an ability to explain things to people. He has an uncanny ability to read what the community sentiment is, because we didn't want to have any civil unrest with all of these things that we needed to do. And also, Commissioner Stevens was very adept at managing emergencies, and he'd been the state coordinator for multiple bushfires and other significant weather events. So I think that put us in a really good place. The other couple of things was that we had a very strong public pathology laboratory. SAPath do about 85% of pathology in South Australia, and I will acknowledge, of course, the private providers as well, but other states have many, many small private providers, and when you need to scale up testing, as you do in a communicable disease outbreak, we really were ahead of the game because of SA Pathology and wonderful people like Dr. Tom Dodd. And the last strength that we had in the pandemic, and this is an international strength, was the way the international scientific community, including Australians and South Australians, came together to develop vaccines. It was phenomenal. When we started in March and we were discussing when will we get the vaccine at AHPPC, no one really knew. We were all hoping that we'd get it within 12 months, but no one knew. We had mRNA technology was being used for different sorts of things in medicine, but the scientists, instead of them all working individually and competitively to get their grants, they realised that this was an international emergency. They worked together and they got those vaccines developed. They shared information. And then the other thing that sped up the vaccine development was a whole lot of people put their hand up and said, yes, I'll be part of a clinical trial. Now, normally, it's hard as a researcher to get people to enrol in a clinical trial. But again, the community said, no, we need to do it. And so the trials got done. There were no steps skipped in the vaccine development or testing. It was just done really, really quickly because it was a health emergency. And I'm going to watch the time because Kay's looking at me. I'm doing well, am I? Okay. So in terms of our strategy in South Australia, it very much aligned with the other states, but the idea at the beginning was to flatten the curve, because if we had a really high peak, it would overwhelm our health system. So the whole idea was to stop people mingling. It's very basic communicable disease. It's what they've been doing, did in the Spanish flu. In fact, I read a little newspaper clip from the Spanish flu, and it was only 10 people could meet, all public spaces were shut down. Like, we were not inventing anything new when we did all of that. But what we found once the international borders were shut, because we had such good contact tracing team here in SA Health, we eliminated the virus. So possibly it popped up a little bit when we just didn't know about it at the time. We weren't doing wastewater testing, but we basically eliminated it. We didn't go into this thinking that we would do that. We were just trying to buy time to get the masks and to set up our health system, make sure we had enough ventilators and such like, and get people trained. And we were cross-training. We were having nurses being trained in ICU and a whole lot of things that Nan here is very familiar with. It was to give us time. But we eliminated we weren't getting any cases. And that was when I was like, yeah, 0. Which actually, because I'm a scuba diver, means okay, which is people ask me, why'd you do that? I'm like, oh, well, it's just natural, because when you're a scuba diver, that means okay. So anyway, then when we realised we eliminated it, it was good, because then we didn't have to have all these restrictions, but it meant we had to keep the border shut, and so that's why the border was in place. And we could keep our economy ticking over with those borders shut, and it meant that, and I'm enjoying the Fringe and the Festival, I hope you are as well at this time, but it meant that we did not stop a Fringe and Festival. We still had them. We had a WOME Adelaide. They were in a different format. I'm looking out at the Oval because we had the Christmas pageants here at the Oval so that we could still continue those things. We made sure that agriculture could continue, that primary industries could continue, that energy and mining could continue, and it was all done safely. And that was important, that we continue to keep our economy strong. And what we were doing was holding off until we could get the vaccines and make people safe, and then we had a planned opening of the borders and let the virus in, and we were probably one of the only places in the world that did that. We got to that stage and we could do that. And fortunately, when Omicron turned up, it was less severe, and we also had oral antivirals. But we saved tens of thousands of lives, and I say we because it's not just me, there's a whole team, but it's also about the community. And so the one thing I wanted to say was so important for me was this strategy of keeping the community on board. And my previous CE, Dr. Chris McGowan, he said to me in the early weeks, Nicola, your job is to keep public confidence. So when people are possibly thinking I'm going to talk about my challenge of being in front of the media every day, actually I wasn't really so fussed about the journalists. Because they were asking various questions, but I went into every press conference talking to you because it was my job to explain to people in South Australia as simply as I possibly could what we were doing, why we were doing it, and how we were going to get through this together. So yes, the journalists do ask questions, and sometimes they keep repeating the questions, but that's actually not my focus when I'm doing a press conference. It's all about talking to what I call my patient, which is the whole of population when you're doing public health. And in fact, I have acknowledged the media in South Australia. They were really helpful. They got our messages out. We would get the advertiser saying, is there anything you'd like us to run, any messaging you'd like us to run this weekend? And we'd provide that information. So I think as a state, because we all worked together on it, we did a good job. So I've just got maybe a couple of minutes to talk about some learnings that I want to put thinking about going forward. So one of the main learnings for me, and I hope that government and different sectors understand this now, is that to have a healthy economy, you have to have a healthy population. And I figured that, yes, we will impact the economy by these shutdowns and these directions and such like, but we will keep the population healthy, and therefore we'll be able to bounce back with the economy. Whereas if you let people get sick, they can't work. It's not about the quarantine and the isolation, it's just that everybody gets sick at once, they can't work, and that impacts your economy. And actually that's what played out in New South Wales and Victoria at this time, beginning of last year, when everybody got sick with Omicron came through. We had a chance to get the third vaccine dose to people, and we put some directions in place to stop people mingling, and it just took the top off that Omicron wave. So we didn't have that experience that those two states did. The other thing is a learning is that there is a very delicate balance between human health, animal health and environmental health. And I don't want to get through any talk without talking about the importance of climate change. It's the biggest threat to health internationally and in Australia. And I'm not going into any conspiracy theories about how the virus came from a lab. My belief is that it was to do with the wet markets and how we as humans impact animals. And when you get animals and humans close together, it's predictable that you will get new viruses coming across and they'll impact humans. And that's exactly what happened. And we are looking out for that now. With the climate change, we're expecting more new and evolving infections. We've had Japanese encephalitis virus because of the flooding. We never had it in our state before, which is mosquito-borne. We had a big outbreak of Vibrio parahemolyticus this time last year in Coffin Bay oysters, again because most likely the seawater's warming and that bacteria is more likely to grow. And then we also had Mpox, monkeypox virus, which was new to human disease, really, and to Australia. So then the other learning that I wanted to talk about, which I'm very passionate about, is that we really learned about strong and meaningful partnerships with Aboriginal communities and culturally and linguistically diverse communities. And last week I was up in the APY lands because we've got an outbreak of TB. The relationships that we developed during COVID, and it was very rushed. It wasn't the best way of developing relationships, but we've built on that since having the pandemic. And I've got a wonderful Aboriginal public health team led by Damien Shen, an Aboriginal man. And what I was doing last week up in the lands was talking to community leaders about TB. And the one thing that really struck me was that they absolutely understood about TB. They were very familiar with COVID and they understood all the requirements that we would need to get this outbreak under control. And when we co-design and work with communities, then really good things happen. The other thing that I wanted to say that we learnt from the pandemic, and I'm keeping on with, is looking after people in our aged care facilities, making sure that they receive the highest level, not of healthcare, but of preventive healthcare. Of course, healthcare, but also preventive healthcare. So we could see that the infection prevention and control in aged care facilities was not very good. So I'm continuing to meet every month with aged care. We talk about COVID, but we just gave them a briefing on TB as well. And we're looking at other things that we can do to support aged care providers in that important space. And then I'm hoping that you will go on with me to have improved your infection prevention and control, and you will be very good at washing your hands when you're preparing food, after going to the bathroom and such like, and you won't be going to work or out and about when you have a respiratory infection. So I'm hoping that we all continue with that. And finally, because it's International Women's Day, one of the other things that my team have learned, but I think we've learned internationally, is we should be embedding flexible working conditions and arrangements into all of our workspaces. We can do this with Teams now. We can have meetings online. And for women and also for men, it means that you can have that better balance between your home life and your work life, and that's good for all of us. Thank you very much, Kate.
Are there any questions? We've got one from Jeff.
Yeah, thank you, Professor Spurrier. I just want to reiterate my personal thanks to you as a GP for the work you did from 2019 in the role you took. And actually, as being International Women's Day, I brought 2 other doctors from our surgery, female doctors obviously, and they also thank you for the work you did. So we appreciate that. Speaking about general practice, and a lot in the media of actually the trouble we're going through and the fact that I'm still working at my age and a lot of others are my age. Unfortunately, we've got some younger ones, but you had some ideas and those things on general practice. I wonder whether you'd share them with the group for us.
Yes, thank you very much. Look, we could talk for a few hours about this, and I know the Commonwealth and the states are looking at Medicare reform, and it really is around primary health care because for the whole of population, it is a universal right to have universal access to good primary health care. And that means GPs, but it's also allied health. And at the moment, to see an allied health practitioner, if you don't have private health cover, it can be very challenging. So I'm a great believer in a strong primary healthcare system. But at the moment in Australia, primary healthcare is funded through the Commonwealth and or through private health providers. And then you've got the hospitals that are funded through and run through the state. And the systems don't talk. And I had the opportunity to go to Israel as part of a COVID delegation last year, and Kerry Chant, my Chief Health Officer friend from New South Wales, was there as well. And what struck us was that primary care and hospital care was joined up, and so the doctors could see, and the doctors and nurses could see the patient's history from primary care through into hospital care. They could see how many pharmacy visits, what had happened in the past history and such like. It makes it so much easier to manage your patients, but it also means from a population perspective, they can have the data to make better and improved policies around prevention. So I'm really a big supporter of primary healthcare, and I'm very pleased that the current government is looking very seriously at what we can do longer term in that space.
Thank you, Professor. I'd like to echo Jeff's comments and thanks, and as a member of the general public, to acknowledge that you really were speaking to me when the media were hounding you. I just wanted to ask you about where we're at with vaccinations, because it's something that's sort of fallen off the radar, but I hear that, you know, there's new vaccinations coming through and we really need to be mindful of the new variants that are coming up.
So that's a really good question. So ATAGI, as our peak vaccination group, we follow their recommendations. They've recently said they are recommending everybody who has not had a vaccine for 6 months or haven't had an infection for 6 months to have another vaccine dose. So I'm not calling it the 5th dose because some people have had 2 or 3 doses, so it might be their 4th. The other catch with that, or not catch, but the other recommendation there is that we access a bivalent vaccine. So they're readily available, the bivalent vaccines. The ones that we had were based on that we need the Wuhan strain in it. So that's bivalent, means there's 2 things in it. We need the Wuhan strain, but also the Omicron strain. So the ones we've got have BA1 and Wuhan, so BA1 Omicron. There is the BA.4/5, both with Moderna and Pfizer. I think the Pfizer was the first one and it's probably on the shelves now. But actually, our variants are BA2 based, so I don't think there's any difference in which bivalent vaccine you get, as long as you get one that does have it covering Omicron and Wuhan. So I got mine and it was a BA1 based Moderna. And I had that 2 weeks ago because I had my previous vaccine 6 months ago. And my mother here, Leslie, she had hers as well that week because she's going overseas and wants to make sure she's protected. So this is for 18 and above, so there's no age limitation other than for the very younger people in our community, but it's strongly recommended for 65 and up. So people who haven't had that dose, please avail yourselves to that. There's no problems with supply. I ring my friend Terry White, who has a pharmacy at the bottom of my building, and in an hour I go down and get my jab. It's very easy. Yeah.
Thanks, David.
Thank you for that fantastic talk. And I think Steve is an amazing. Quick, how is the virus progressing? How is the virus progressing?
So we're just going to have to keep watching it, right? Because, again, we don't have a rule book about a new virus. So we knew theoretically that it will, that as a virus replicates in the body, so divides in the body, it gets an opportunity to change its genetic profile. So we're expecting it to get new strains, but exactly how that's going to pan out is not predictable. We know that when there's uncontrolled disease, there's lots of people getting sick, it has more opportunity to change. And also when people are immunocompromised, so their immune system doesn't work as well, it can hang around in those individuals' bodies for longer, and that means it gets a chance to change itself, and a stronger variant then can grow and get that advantage. The other thing that viruses do, and we knew this from other viruses, is they can join up and they and you get these what so-called recombinants, and that's all those XBBs and such like that you see coming up on the news. But there's no way of predicting how that's going to pan out. Having a well-vaccinated community does mean that we keep check of the number of people with the disease and reduces that risk of other additional strains. Flu's been around for thousands of years. It's had an opportunity to infect lots of people. Our bodies have had a lot of opportunity to be exposed to flu. It means it's a bit more predictable. We know now that there's seasonal pattern with flu. However, I did see a quote recently on the Doherty website saying if you've had experience with one flu season, ... you're probably thinking, then I know what flu's about, but it's actually, if you've had experience with one flu season, you've had experience with one flu season, right? We can't predict what the next one's going to be like. We have a suite of things that we can do in terms of surveillance. So we continue to do wastewater surveillance in our state for COVID. And not only do we look at the counts, but we're also doing the genomic testing on it and looking at the variants and keeping track of that. And then we're using the mathematical modelling. Again, there's lots of things that we developed during COVID that we want to keep using with Adelaide University, and they're doing our flu modelling as well. And we put the knowledge about those variants into it. Basically we're tracking it as carefully and closely as we can. And I get I get information from AHPPC with an international lens so that we keep an eye on that as well. Yep.
One more, last question. Oh, one more. Okay.
Thank you so much for the speak. It's amazing. And I just want to say thank you because all of the strict measures that has been done, you wouldn't actually know it until you lose someone you love, which we lost both parents-in-law a week apart because of COVID back home in Jordan. So I understand how it might be strict or difficult for others, but seeing the impact of it, it's actually more emotional. So thank you.
Thank you for sharing that story. For people that didn't hear that, I just feel a lot of sympathy and empathy for you and your family. This is one of the things in public health. It's called a prevention paradox. I've got a little picture of it actually in my room, and it's Piglet and Pooh walking through the snow. And Piglet says to Pooh, how will we know our pandemic plan is working? And Pooh says, they'll say we overreacted. And they're always telling me that, yeah? And then Piglet says, so when we're right, everybody says we're wrong. Welcome to public health, Piglet. And so when you prevent bad things happening, people go, well, what was all that about? Nothing bad happened. And I'm passionate, and my team is passionate. And Dr. Chris Lee says, we don't want to wait to have all the bodies lining up. But that's almost an expectation, as people won't move until that happens. So, I'm just really grateful that you shared that story with us. Thank you.
One more question? Joe.
Thank you. My question is, did you get a chance to have a break after all of that?
Oh, yes. I didn't have much of a break during the pandemic. My mother said, she lost her daughter. But anyway, you saw me on TV. So it was very intense, obviously, but when you're doing something which you're really passionate about, it aligns with your values. And also, I have to say, our government really backed me, and we had bipartisan support here. Different in other jurisdictions, I think, but here I was really supported, very much supported. But I did get a break. I hadn't had very much annual leave. So last year I took 5 weeks off and went to Italy with my lovely son Hugo, who at the beginning of the pandemic was about this tall, a wee bit on the chubby side, and by the end of it is this tall and extremely thin. And just had a wonderful time, just Hugo and me swanning around in Italy. So yes, I did have a lovely break, and my husband organised it for me, and I didn't even have to do any of that planning.
That's the way to go. In thank you, Nicola, just before you go, I've got a present for you. Well, a gift, thank you. I was going to mention the ups and downs that Nicola's had through her challenges, but from what we've heard today, it was more ups and very few downs, and for that we're extremely grateful. My personal story about Nicola and her mum. When her mother was receiving her honorary life membership of the Australian Society of Cytology, Nicola had just had her first baby. So I'll get this sorted. Yeah. Oh, thank you. a certificate.
Thank
and
you
thank
very
you
much,
for appearing
Paige.
today.
Oh.
And a little Rotary bear.
Thank you very
And
much.
that's to accept this. Thank you certificate and the Rotary teddy bear. All monies raised today go directly to Rotary community and youth projects. So thank you again, and may you continue to keep us safe.
Thank you very much.